as economies start to reopen here in the U.S., some are looking at Sweden, which never really closed. The country has taken a different response to the coronavirus, leaving restaurants and schools open, but banning crowds of over 50 people and encouraging social distancing. Not all scientists agree that this has been the right move. Dr. Nele Brusselaers is an associate professor at clinical epidemiology at the Karolinska Institute, the premier medical research institute in Sweden. Thank you so much for joining us, Doctor. Do you agree with Sweden's strategy?
I think it's a very risky strategy, which is costing many lives already, especially if you compare it to the neighboring countries, Norway, Denmark, Finland. Sweden has way more deaths already. And one of the biggest risks is if the current measures don't work, well, even if you implement them now, they won't show any effect in the first few weeks. So it's a big gamble. I don't think the numbers are reassuring for now.
We're looking at the number of deaths on the screen, 2355. You know, some people say that those deaths per population are comparable to the death rate that we're seeing here in the United States. And it's actually lower than places like Italy, Spain, and even the UK, even though they haven't taken as drastic measures to shut down. How do you respond to that?
Well, we are later on the curve. So Italy, of course, started earlier. Italy has had a lot of cases already in February, March. Here already, it started only mid-March. So, but we are fastly approaching. If you look at the numbers of deaths per million, we're actually higher than the United States. And an important fact is also that more than half of the cases are only Stockholm, which is a city of only 1 million individuals. So Stockholm itself is similar as New York for the moment, or close.
How are the hospitals faring? Are they able to handle the capacity?
There are reports now emerging that intensive care units all over the country start struggling. So it's not clear which counties are now in problematic situations. We also know that many people do not arrive on intensive care. There have been guidances for triage already from mid-March, although it has been denied that they were used already in March. So many people are not receiving the health care or intensive care already because of, but they say that there's still some beds available. Last report I saw that were like 30% of beds available of the ICU beds available in Sweden. But if we look at the age distribution, we see that older people are less likely to get a bed on intensive care. So no 80 plus. People and also a lower and lower proportion of people 70 plus 8 years old. So there is a lot of strain on the hospitals.
No question, and we see that here too. There is a theory that Sweden may be reaching herd immunity, where enough people are actually infected with the virus that they can sort of make it go away, something that a vaccine does. What is your opinion about this, and how are you even able to tell?
Well, the numbers that we see is that you would need 40 to 60 or maybe even higher proportions of the country to be infected or vaccinated to reach herd immunity. So even if less than 1% dies or like 2% ends up in intensive care, this is thousands of people. And we are still far from those numbers as well. So indeed, they have been giving contradicting information. First, they said that it was herd immunity. Then they said it's economy. But now they are quite clear indeed in their directions that it would be herd immunity that they're striving for, because they don't take any strong measures to really slow down the spread in Sweden. Yeah.
Dr. Brusselaers, thank you for joining us tonight.
Yes.
Please keep us posted.
Yes.
Thank you. Let's turn back to now Dr. Jeremy Faust for a moment. What do you make of the way Sweden has dealt with this outbreak? Stands in such stark contrast to what its neighboring countries and most other countries around the world have done.
Relying on a herd immunity argument is basically what you do when you've exhausted other options and you're giving up. That is unbelievable to me that that's what they're trying to justify. It kind of also reminds me, we're weighing lives versus economics and everything else. It reminds me of a sort of infamous study in which the Czech Republic wanted to determine whether smoking would save money. and it turned out that smoking saved them money because the early deaths actually they saved money down the road on, their equivalent of Medicare beneficiaries and Social Security. And it was a flabbergasting result that was published and that led to outcry. We can't be trying to weigh lives versus money, but that's kind of what's happening, I feel.
But how do you make sense of the fact that their death rate per capita, at least, has not grown past levels in Italy and Spain I mentioned and other European countries? I know it is much higher than some of the neighboring countries like Denmark and Norway, but certainly it isn't that far off from the rest of the world.
We should be watching that very closely, and here's why. When you open up, who goes out? The young and the healthy. And they'll become infected, and then a week or two later, some of them will become sick, but not enough to overwhelm a hospital. But over time, those healthier individuals will spread it to the nursing home, to the older patients, older individuals who aren't going out, and that's when you get a big, huge spike in deaths. So the number of cases you get certainly correlates to the number of deaths you get, but if it goes through an older community, then the death rate skyrockets. Here in Massachusetts, for example, the average age of death from a coronavirus patient is over 80, even though the average case is the age of the average person with a case is in the low 50s, I believe. So we have to protect the right people. And it feels okay to go out at first, but I really worry that 2, 3, 4 weeks down the road, then those healthy people did transmit it to older folks. And sure, your number of cases might come down, but the deaths will skyrocket.